Okay, good morning once again. Apologies for starting late. I welcome everyone to our webinar session. My name is Bisi Roland once again from Post Service Department. And on behalf of the head of service, Mr. Dr.A.Adegoke, our permanent secretary, Public Service Office, Mrs. Sukomi Oyegbola, and of course, the Director of Post Service Department, Mrs. Durodola Olushola. I welcome you all to the first webinar session for the month of September. Yeah, your presence here today shows your commitment to your health and safety. Today's session is, our topic for today's session is designed to empower us with hands-on strategies to respond confidently and effectively. And the topic, which is first aid and CPR for everyday emergencies, life-saving skills everyone should know. Yes, we should know about first aid, how we can respond confidently and effectively to everyday emergencies. And our facilitator is Dr. Adegoke. Before I call her, I'll just quickly take her profile. She has an MBBS from the University of Lagos, and she's a holder of a certification in leadership and management in health from the University of Washington. She is a highly accomplished medical doctor and healthcare leader. She has contributed significantly to advancing healthcare access and quality through her work with non-governmental organizations, NGOs, and government programs. She's the author of Defeating the Silent Killer, a personalized guide to managing high blood pressure and achieving wellness. Dr. Adegoke uses her writing to share practical insights on healthy living. She currently serves as a medical officer with Lagos State Ministry of Health, where she remains dedicated to transforming healthcare delivery in Africa and beyond, and also inspiring individuals to embrace wellness. Dr. Amina, good morning.
Good morning, ma. Can you hear me?
Yes, we can. Good morning. Thank you for joining us. Thank you for being here. And oh yeah, before you start, please, I'll encourage everyone to please listen attentively and take your jottings down. So when we get to the question and answer session, we'll take your questions. Thank you. All right, Doctor, over to you.
Good morning, ma. So, good morning, everyone. Good morning, sirs and mas. I'll be taking first aid and CPR this morning.
Yes, I'm trying to share your slide.
Okay,
It was
I'm trying to.
sharing
I'm
before. I
waiting.
don't know.
Okay.
Should
I go ahead or should I
not
wait
sure
for the
what
slide?
happened. Yes, no, go ahead so that we won't waste more time.
All right.
I'll just
So
try
good
to
morning
get it back.
again, stars and mas. It's a privilege to be talking to you this morning. So I'll be talking about first aid and CPR for everyday emergencies. Life-saving skills everyone should know. So that's what we're going to be walking ourselves through this morning. So why this topic? Why does first aid and CPR matter? The truth is, emergencies happen anywhere, at home, in the markets, in worship centers, that's your mosque, your churches, at community events. You know, emergencies happen everywhere and anywhere. And the first 5 minutes of an emergency, of a health emergency, is very critical because it can save a life. Whatever you do in those first 5 minutes, can be the difference between life and death for an individual. So it's very important we all know this because it can
Can you see
happen
the
to
slides now?
anyone.
Can you see the slides now?
Yes, it's up.
Doctor, sorry to
Yes,
interrupt.
yes, yes, it's up. It's up, ma. You can go to the
Okay.
next slide. Yes.
All right.
So it can happen to anyone, anywhere, anytime. So it's very important. So knowing simple steps, that we can take to save lives before, we eventually get to the clinic or get a healthcare professional to take over. Very important. So have we ever witnessed any emergency at home or in public? I don't know if I can get like a show of hands. Have we ever witnessed any emergency, whether at home or at work or at our worship centers? I don't know if I can get a show of hands just to be sure that we are together before I progress. Sad Amas on the line. I don't know if you can hear me. Yes, okay, so I can see one hand. So I'm sure there are many other hands that will come up because the truth is, at some point in our lives, we have witnessed one or two emergencies, either at home or in public. So what are the common emergencies that we tend to see? Ma, the next slide, please. Falls, fractures, especially as you age, you know, eh, falls, fractures, and also for children. It's common in that age, cuts and bleeding. Yes, I'm sure at some point in our lives, we've seen that, whether be it small or large, we've seen that. Then fainting and dizziness, fainting and dizziness. I'm sure at some point, if it's not you, maybe somebody has fainted and you're wondering, what do I do next? How do I go about this? Then burns, whether large or small, even if it's small burns in the kitchen, how do you manage it so that it doesn't leave a scar or become something else? And then, yes, so burns, choking, especially in children and, the elderly. That can also be rampant. Then sudden collapse or cardiac arrest. What do you do when somebody has a cardiac arrest? Because all these situations are things that can happen to anyone, anywhere. So how do you help? And why this is very important is I remember a colleague of mine, that's how she saved her father's life. He had a cardiac arrest, and because she could do a CPR, the man lived extra 10 years after that particular episode. If she could not do CPR, that probably would have been the end for him. So we just never know. Some of these skills we pick up might be very useful to not just to outsiders, even to people, our loved ones that might save their lives. So it's very important we, acquire some of these skills. The next set slides, man. So yes, first aid. What exactly is first aid? First aid is the first and immediate assistance given to anyone suffering from either a minor or serious illness or injury. So why, so it's either it can be minor or it can be, major. So, that first thing you do, when something happens, that is first aid. And why do we do it? Is to three major things, three major reasons. Number one, to preserve life. That, okay, I don't want anything to happen to this person. Let me preserve the life. Yes. And to also prevent the condition from worsening, So if you do something, that condition will not deteriorate and become worse. And also to promote recovery so that the person will recover fast. So those are the 3 Ps of why we're doing first aid: to preserve life, to prevent the condition from worsening, and to promote recovery. And first aid to treat simple injuries or to do first aid in any emergency can be that difference between life and death. So the next slide is first aid kits. Sorry, ma, next slide. So when you're considering purchasing a first aid kit, these are the things, you can have, you should have in a kit. So the kit could either be in your house or in your car. Even ideally, the Federal Road Safety Commission, says we should all have a first aid kit in our car because anything can happen. And having that kit can also be different in life and death. And also in the house, things happen in the house. and then you might need a kit. So for a basic first aid kit, you need plasters, bandages, antiseptic, gloves, pain relief, torchlights, phone numbers of it could either be your family doctor, a nearby hospital, or the emergency center. The last time, so one of the things I want us to know today, we have an emergency center in Lagos State, that is working efficiently, in Alausa there, and they would, once you place a call to them, they would answer 112 or 767, and for people that have maybe a family doctor nearby, or their own hospital nearby, that we should also have the emergency call line for those, have it close by. It could be in your first aid kit for anybody, and then it could be on your phone too, so that it's written there, because it's very important. Anything can happen anytime. Nobody is beyond any emergency. I want us to remember that. So having this this information and these tips can actually help. So let's not forget the last and bus line 112, or you do the 767. So one of the things that we need to learn when it comes to saving lives or doing anything is hand washing. Very important. I remember during COVID, it was really, really emphasized, hand washing, whether before and after. You have touched, I don't know, it could be somebody that had a big cut, you have touched blood, you've touched whatever it is, you need to wash your hands. And when it comes to washing hands, a lot of people just, I've washed my hand. You just go put soap in water, put soap on your hands and wash fast, and they've left the place. No. There is a recommended standard when it comes to washing hands. You completely wet your hand generously, and then you apply soap, and then you wash vigorously in between all the centers, the back, the front. You wash well for at least 20 seconds. So if you have to count 20 seconds, count it, because the soap has to be on to be sure that you've gotten rid of at least most of the germs. So, and then you rinse your hand with, under running water. And then you dry your hands with a towel or a dry. So that's, just very important. When it comes to hand washing, it's a major thing. We need to know how to wash our hands properly, because it can help us in, when it comes to not also harming ourselves in disinfecting. So imagine somebody let me give an example. Imagine somebody has an accident, there's a cut, you go there, you go to help, and then, you have some spills on, you don't know what the person has, in their bloodstream, and then you have some spills, and you couldn't even wash your hand properly, and then you contract something that way. So yes, so it's very important we wash our hands, and also use gloves when you are dealing with blood. So when you don't avoid touching anybody's blood or fluid substance, bodily substance, with your hands alone. So you use gloves. So when you take off the gloves, you also wash your hands. So that is that on that. So what's the first thing you learn when it comes to first aid is Dr.A.B.C.D. That's an acronym, so that we won't forget. Dr.A.B.C.D. Please, let's not forget. Doctors A.B.C.D. So it's spelled D. That is for, that's in D. Dr. R, the acronym of Dr. DR, doctors, DRS, ABCD. So what does that mean? D is for danger, R is for response, S is for send for help, A is for airway, B is for breathing, C is for circulation or CPR, and D is for defibrillator. Sorry, next slide, so that they can see what I'm saying, please. Doctors A, B, C, D. Very important. SARS and MAS. It's very important we have this acronym, because whenever there's an emergency, this is what you should follow. Whatever the emergency is. At home, somebody collapsed, somebody fainted, somebody has a cut, whatever it is. Doctors A, B, C, D is the line you follow when it comes to first aid. It's the standard method. So it's an acronym. Doctors, that's D for danger, R for response, S for send for help, A for airway, B for breathing, C for circulation or CPR, and D for defibrillator. So I'll take us through what I mean when I say doctors A, B, C, D. So whenever there's an emergency, you ensure that there are no dangers to yourself and other bystanders or the patient. So let's create a scenario. You are driving through, maybe in Alausa, and then you see a car, you see there's an emergency, there's been an accident. You probably even know the person, one or two of people involved there, and you want to come down to help. The first thing you have to make sure that, hey, me coming down, I hope there's no danger. Where I'm parked, I hope no car can come from behind and hit me. I hope where I'm going to stand, am I going to stand on the road where a car can come and crush me? Am I, make sure the first thing you make sure that there is no danger, or somebody gets electrocuted. You don't just go and rush off and touch the person, because if you touch the person, you are endangering yourself too, because the shock. So the first thing is, switch off the switch, that, okay, you are sure that the electricity is disconnected before you touch the person. So you make sure that there is no danger to yourself or other people around, or even more danger to the patient, the person involved, person you are trying to save. So you ask yourself, why this person collapsed? Is there any other hazard? What am I at risk of? So like I said before, if you're on the road, maybe dangers of a moving vehicle coming to crush you when you're trying to help somebody, electricity, water, other people, smoke, fire. So when it comes to, okay, there's the fire, is it something you can just, and you're not a trained firefighter, so it's probably, if the next step for you in that kind of places, you've already ascertained, danger, I'm in danger here. So you step back, so you know that there's nothing you can do in that situation. But if it's a small fire, that, okay, probably what I need to do is get a big blanket to quickly switch off, you can do that. So just make sure that there's no danger to yourself. So yeah, because if you harm yourself at that point, there will be two patients, even more than one. So please, let's try to make sure. So only enter the situation if it is safe to do so. Remember, you are the most important person, very important. So while trying to save somebody, don't harm yourself. So danger is the first. That's for the doctors, ABCD we are following. D for danger. Then R for response. So you have ascertained, okay, there is no danger. I can go ahead to save this person's life. R for response. You try to see, is this patient conscious? Is this patient responding? You ask, try to wake them up. So the first thing is, in terms of response, is you call the person's name, or you say, hello, can you hear me? Can you hear me? Or if you need the person's name, let's say the person's name is Bolu, 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 Bolu. That's the first thing. You forward use your voice. Okay, the person is not responding. Then the next step, you tap lightly on the shoulder. That you tap the person to see if the person will hear you. That is, you are going to tap in the person, because when you said the person, then the person did not respond. Some people will respond, so you don't need to tap. You go to the next line of action. So, but if the person did not respond just by mentioning the person's name, the next thing you do is to touch. You tap. You tap the person. If you still don't get any response, you try to inflict pain. So how do you inflict pain? When I mean inflict pain, just something like, just to, try to get a response from the person. You can pinch the ear. If you do that, for somebody that is conscious, or the person will wince, you see the mild movement, person will react to that pain. If you don't get any reaction from that pain, that person is definitely unconscious. So so we are trying to see this person responsive. Because for an unconscious patient, you don't have to ask for permission. You just go ahead. That's good Samaritan law. You go ahead and help. But for a conscious patient, you have to ask, I just you suffered an accident. I'm trying to help you. Can I go ahead? You have to ask for consent that, can you go ahead before the case turns to something else. But for an unconscious patient, you don't have to. So we've done the danger. You've ascertained no danger. You have response. You've called this person is not responding. Then the next one is send for help. Doctors, DR, then now we are for S, send for help. So how do you send for help? So it depends on where you are, and what the situation is. If you're in an open place, you call for help. Somebody will come and help and join you. And then, the help you are trying to send for is to get to a place where the person will get definitive treatment. So you are trying to call the ambulance. So you can call 112 or 737. That's for the Lagos State Ambulance Services. And if it's a place where maybe they can't get to easily or fast, and a neighbor, you can call the ambulance service for the nearby hospital, or you call your family doctor. So, just try to get help. That's the next thing you are doing. Don't leave the patient. Try to get help from. So if you have to shout, if you have to bring out your phone to make the call, so you are going to try to get help after ascertaining if the patient is responsive or not responsive. Then the next thing you are checking, we said doctors A, B, C, D. So the next one is A, airway. You are trying to check the airway of the patient. So what I mean by airway, I'm talking about the connection between the mouth, nose, and throat. That's the lungs. So that's the airway. So you want to see if this patient is breathing. And then you have to also make sure, trying to also make sure that the patient is not lying in a way that it can actually block the breathing of the patient. So if a patient is unconscious, the tongue can fall back, thereby blocking the breathing of the patient, especially if the patient is lying down, on the is lying down with its back on the floor. So you have to make sure that you have to adjust the head in a way that there is proper airflow and there won't be a situation whereby the tongue is falling backwards. So how do you do that? You place your hand on the person's forehead and you push the head backwards. So let's know this acronym: head tilt, chin lift. Look at this. Look at the picture here. Look at the blocked airway. Person's head is just straight. So for an unconscious person, the tongue will fall back and it will block that airway. But for somebody that is, please, can you go to the picture so that they can see it? Airway. I'm waiting so that they can. I'm trying to go another slide. The next slide. There's a picture there.
Is it on that airway?
Yes, there are two. Down.
Oh, okay.
Yes. So this is the picture I'm talking about. So the first one, yeah, it shows a blocked airway. Patient. So the tongue is falling back. This is for an unconscious patient. Too. For a conscious patient, the airway is most likely open. So what you now do for an unconscious patient is you do head tilt, chin lift. So that the forehead, you're going to put your hand on the forehead and you try to tilt the head backwards. Then you now put your second hand under the chin and you lift it up. So that way you're opening the airway. So that's what I mean. That action alone can save a life. Then the next slide. So we've done doctors A. Now it's time for B, breathing. So what do I mean by breathing? We've checked. Now you have to come close to this person. This person that you have opened the airway. Is this person even breathing? So you check. How do you check for breathing? You look, you listen, and you feel. That's the way you check for breathing. So we all know that when somebody is breathing, the abdomen area will be going up and down, up and down. So you look, can I see that? You might have to maybe unbutton the shirt for that, just to be sure. If you can see that, okay, the person is breathing, you don't have to move on to listen and feel. What if you cannot even see the movement of the chest or the abdomen up and down? Okay, you now go close. If you go close enough with your ear, you should be able to listen. You should be able to hear the breath sounds. Then you might have to also feel. Put your hand close to the nose, nasal area. You should feel the breath drop on your hand. That is, and all this checking of breathing, they are doing it in 10 seconds. Remember, we are trying to save a life. And saving a life, all these things should be concluded in 5 minutes. So it has to be something fast, fast, fast. So when you are checking for your breathing, you are checking for that breathing within 10 seconds. So a person can be unconscious and still be breathing. We all know that. So the problem is when the person is now unconscious and is not breathing, then you might have to save the person's life, do CPR. So, but if the person is breathing, okay, this person is unconscious but is breathing, what you now have to do is put the patient in recovery position. Do you understand? Put them in recovery position. I will show you as we progress. I'll show you what I mean by recovery position and while the help comes. If the person is not bleeding or there's no other thing that can deteriorate, you just put the patient in recovery position while the help comes. Yes, so that's that for breathing. But if the patient is not breathing, the next thing you are checking circulation. Is this person the pulse? You can check the pulse on the hand and on the neck. Look at this image. It shows the pulse on the hand and on the neck. Sorry, the next slide, circulation. There's a picture there. I want them to see how to check the pulse on the hand and on the neck. So this picture, so you check the pulse. You put your two hands there. But if you do that, even for yourself right now, Sadaman, I know you can hear me. If you do on yourself right now, if you put your hand look at this picture, just put your hand on that side, you'll be able to find like a vein hitting your hand back. Same for your neck too. If you do that for yourself, you'll be able to feel it. So for somebody that is alive, you should be able to feel it. If you can't feel it, the person has probably gone into arrest. Do we understand? So that's that for circulation. So C on C, circulation or CPR. So you don't feel any of that. And you couldn't even feel breathing. So what do? You do CPR. You are trying to resuscitate this person, bring this person back to life. So what is CPR? Cardiopulmonary resuscitation. What does cardio mean? Heart. That's cardio, the heart. Pulmonary, the lungs. Resuscitation. So you're trying to resuscitate the person, bring the person back to life. It's the first aid technique used to help people who suffer a cardiac arrest. Next slide, ma. You see, so is the first aid technique used to help people who suffer a cardiac arrest, like when their heart stops beating. So it involves chest compression and rescue breathing to keep the patient alive until a defibrillator arrives. So chest compression and rescue breathing. So once you've done that CPR, I'll tell you how to do it. But once you've done it and the patient has become responsive, the next step is to, how the patient will come. You see people suddenly they just start breathing normally, or they cough or they talk. The patient has come alive. So once that has happened, you put the patient in recovery position. This is what I mean by recovery position. Look at it, please. Let's look at it properly because it's very, very important. This knowing this recovery position, man. Please, I need you to go to that picture of recovery position. Yes, this is what I mean by recovery position. So you use one hand to support the head of the patient. So you're trying to lift the head up, because in that kind of situation, you might not have access to pillow or a cloth. So you use it to support the head of the patient. And then you now put the knee, you put the knee like in front of the tummy, in front of the stomach, so that it will prevent the body from rolling onto the stomach. So the patient is lying on their side. Just look at that position. Yes, so that's how we want, and that way the airway too will be clear. So this is the recovery position. So this is how you stay with the person until when the patient gets to the clinic or when the medical help comes. So this position will prevent any aspiration, will prevent any further complication. So once you have done your CPR and patient comes back to that, just put the patient in this position, till when the next steps are being taken. So now how to commence CPR. Next slide, ma'am, because I need them to see the picture of how your hand should be when you commence CPR. So you already done, you've checked for, we are following doctors ABCD. You've checked for danger, you've checked for you've checked for response, you've called for help. Very important to call for help before you start doing CPR. You've called for help, you've checked the airway, you've checked the breathing. Now you want to do CPR. You are going to give 30 compressions. So look at that sternum over the breastbone. That's where, and then you interlock your hands. I don't know, madam, sir, where you are now, you can try to do that interlocking of the hands. Then you push down 30 times. So that pushing down 30 times, you have to get at least 120 compressions in 1 minute. That's how you know that you have efficiently done the compression. Next slide, ma. It is more, the picture is more clear in the next slide. Yes, look at this A. A is showing you the points. That's the point where you're supposed to push in. Then you interlock your hand. Then look at, that's how it's supposed to be. I don't know if you have a pillow beside you, just to practice it at the moment now. So you're supposed to push deep. So about 5 to 6 centimeter deep. So that's how you know you're really doing a chest compression. When you're truly saving somebody's life, if you're even doing it at some point, you might break a rib, but that's not to fear. The rib will heal later. The most important thing is to save the patient's life. So you ensure your fingers are locked, your shoulders are positioned above the chest, so you're not leaning in on the patient. They're not just resting and leaning. Your shoulders are straight, and then you have placed your hand and then you keep going down. Once you go down, you compress it, you allow it to come up, then you go down. That's one. You allow it to come up, you go down. If you don't allow it to come up before you go down, you know that you just keep pressing it down without allowing it. You just to recoil back up. Don't lean on the victim's chest. I hope we understand. Maybe during our question and answer segment, if there are any questions, please let me know. Yes, I hope you understand this part. So we keep doing that. This would work for an adult and children, but for infants, I mean between the age of 0 to 1 year, you can't use your hand. like that because it will be too big. You use 2 hands instead. It is 2 hands, 2 fingers. I mean, look at the way the person is pushing down with 2 fingers. The next slide, so that they can see how to do it for an infant between 0 to 1 year old. So you actually use 2 fingers to push down. You remove any shade. So for anybody you are doing CPR for, make sure that they are young. You can't do CPR when the patient has clothes on. So you have to remove the clothes. Yeah, so for adults, we know you said 5 to 6 centimeter deep, how you are compressing it. But for infants, it should be 4 centimeter. And don't forget, we have to make sure the chest come back up before we go down again. So I think we are doing 30 compressions. 30 compressions, 2 breaths. 30 compressions, 2 breaths. So you have to have done at least 100 to 120 compressions in 1 minute. Please, during question and answer segment, if you are confused about anything here, let me know so that I can explain further again. So now, this is what I mean by rescue breath. So when you have done 30, 1, 2, 1, you just come back 2, like that till 30. You give 2 breaths. You give 2 breaths. You give 2 breaths. So this is how to give 2 breaths. You do that. You push the head of the patient backwards. That head tilt and chin lift, and then you close the nose. Look at, and then you give the breath over the mouth. So normally, for most people, because anything can happen to anybody, to a stranger, you might not want to use your mouth directly on a stranger. We have mouth masks for people that are properly trained. But since when we are still doing just virtual training, not the physical training, I would advise you stick to only compressions. That also helps. Only compressions. So you know that in 1 minute, you have to have pressed that chest up to 100 to 120 times. But for people that are trained, after 30 compressions, they give 2 breaths, like the way it's shown in this picture. You give 2 breaths. By the time when you give 2 breaths, you watch the chest come up. Don't overinflate the chest, but you give two breaths, and then you continue again 30. You give 2 breaths again, continue 30. But if you don't get the physical training, I advise you just stick to only compression only. That means doing 100 compressions in 100 to 120 compressions in 1 minute. So that is that for the CPR. So we have spoken about the doctors. That's A, B. Sorry, you didn't show them the picture of the breaths, man. Please kindly go to the down, so that they can see the breaths. Yes, this is what I mean. Holding and then give breaths. But for an ideal situation, you're supposed to use a mouth guard so that you don't kiss a stranger. So now the next one, we have done A, doctors, we have done D, we have done R, we have done S, we have done A, we have done B, and we have done C. The next one is D, that's defibrillator. So the full thing is AED, automated external defibrillator. You will find that AED if you go at PSO in Alausa there, downstairs, you see it there. And do you know why it's there? Because anything can happen to anybody, and it is life-saving. If you are serious for, I think the government, even internationally, any company or organization should have the AED in the building, or any place where you have people gathered, because anything can happen. AED. I don't know if you watch movies, especially the foreign movies, when they take a patient to the hospital, they open the shed and they say shock. They are trying to shock the heart. So that is what that's using the AED defibrillator. It's a life-saving device that helps somebody who is having cardiac arrest, so somebody that's gone into arrest, someone that is not breathing again. After you have done that, once you are done with your compression, once the AED comes, you use it. So it's just a machine. The instructions are there. There's nothing to cram about it. And you make sure that the patient's chest is exposed, and you put the pad on the chest. There are 2 pads. You put it on the right and the left side of it. But for children, sometimes their chest is too, especially all those children below 8, the chest might be too small for 2 pads to stay. You put one in front and one at the back for them. The AED is self-explanatory. It will give you all the instructions. Once you switch on that machine, you tell you all the things to do. All you need to do is follow it. To tell you when to shock. And when they say shock, nobody should touch the patient. When you are shocking the patient, nobody is touching. All hands are off the patient. So that is that for the AED, and you watch the patient come to life. So after shocking and there's no response, that means the patient is truly dead. Then you can call code. So you see, a lot of people, if we have things like this, a lot of people in Nigeria might have the higher chance to making it. So that's that for doctors ABC. Those are the major steps when it comes to saving somebody's life. Try to that you notice is not breathing or is unconscious. Then after that, sorry, ma, we are done with doctors ABCD. Now let's go to the next. We're talking about choking. We are done with all the slides. Please go down after defibrillator. No, no, yeah. Please, we are done with doctors ABCD now. So I want us to talk about choking. So what happens when somebody is choking? So somebody is choking. Choking can happen to anybody. You can be eating fish, maybe, and the bone gets stuck in your mouth, in your throat. It could be it happen to an elderly person, or even children. A child beside you, you can see them, struggling to breathe. Their eyes swelling, trying to breathe. That maybe they've choked on something. Especially children, they can choke on groundnuts, on peanuts. All those ready for infants. And then even adults can choke on fish bone and all that. So what do you do? The first thing is encourage them to breathe. Yeah, breathe, cough, cough. Because sometimes when they cough, it will bring out whatever it is that is blocking the throat. That's the first step. When someone that is choking, you tell them cough, 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 cough. After saying cough, 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 and the person is not coughing, the next step is you bend them forward. Not backwards, forward, the back forward. And then you give them back blows with the heel of your hand. You give them back blows on their shoulder blade, below their shoulder blade. They give them 5 back blows. Hello, can you hear me? Can you hear me? I can't see the slides. I think the host has been logged out. I think the host has been logged out. Sorry, please. I think we should wait for the host to log in back so that she can share the screen and so that I can continue, because I want you to see a picture of what I mean by when you are when somebody is choking. Okay, she's back. Sorry, ma, I think you were logged out. Kindly help share the slide again. The host was logged out, so the slide went off. She will help share the slide now. So what we're talking about before the slide went off was choking. So I said that if somebody is choking, the first thing you tell them to do is cough. Sometimes when they cough, it will remove the blockage. And if after trying that, the blockage is still not off, the next thing you tell them to do is to lean forward, and then you give them 5 back blows with the heel of your hand, below their shoulder blade. If after that it's still not removed, then you now do abdominal thrust, which is called Heimlich maneuver. The next picture shows how to do that. I don't know if the host has not been able to share the slides yet. Let's give her some minutes, please.
I'm so sorry about that. Where are you now?
I was talking about choking. I had to stop because I wanted them to see the picture. Please, yes, the picture.
Okay, so I should
Choking,
go back to
under
choking.
choking.
Okay.
Yes, the picture beneath choking.
Okay, so should I leave it here?
Yes. So after you've done that back, you're giving those back blows, and the substance doesn't still dislodge, what you do is to give abdominal thrust, which they call Heimlich maneuver. So this is what you are doing. See how you are making a fist, and then you use your second hand to push in through from the abdomen to the chest. If you do that 5 times, in a normal circumstance, whatever it is should be dislodged. So you can do this for children and for adults. So that's for choking. Then the next slide, ma. So we've spoken about, okay, doctors A, B, C, D, that's for the CPR. We've talking about choking. Then another common problem that can need first aid is breathing problem. People can have not breathing, but people can have breathing problem if they have asthma, especially people that have asthma, pneumonia, and also in some cases of heart attack, stroke, seizure, anxiety. That's people that have all those things too can come with breathing problem. But the most common and the most life-threatening one is people that have asthma. So for them, you see that they're wheezing, they're making one sound like that is not normal. So what you're supposed to do is actually, for you, from the first aid level, is to use their inhaler. You ask them, where's your inhaler? So you shake it, you place the opening, so you tell them to exhale, and then you place it in their mouth, and then they inhale it. They hold their breath for 10 seconds, and they keep doing that. So for some people, it will still not get better. You need to rush them straight to the hospital. For some people, it will get better, and then maybe they'll go and see the doctor when they are well rested. So that's how you solve the breathing problem in asthma. Sorry, the next slide, ma. I was talking about it so they can see the inhaler. Next slide. Yes, so this is what I mean. Yes, then the next slide after that, please. Another thing that can happen is allergic reaction. People have allergies to food, to medication. So what do you do when you have an allergy? Even children, some people, they have kids that are allergic to, crayfish, granules, just name it. Some people are allergic to some medication. I once went to a patient that is allergic to even anti-malaria medication. What do you do? So what kind of signs did you see when somebody is allergic to something? You see they start having wheals like that, like rashes will just start appearing all over their body, or maybe a part of their body will start swelling. So what do you do? So there's something called the EpiPen. It's not really common in Nigeria here because it's expensive. So you should find an EpiPen in a foreign first aid kit. But if you don't have EpiPen, what you can also do is to use antihistamine like Benadryl or Loratadine. So Loratadine is very common. I'm sure one or two people on this call will know what Loratadine is. So whenever any of those reaction occurs, you can just use one tablet as of Loratadine, 10 milligrams, and the person will get better. Or Benadryl is also it can be used. It can also be that this consequent diphenhydramine can be found in Piriton too. So some people use that for allergies. So that's very important, because that can happen for some allergies. They can be deadly, because imagine the throat swelling. That way it will block the airway and person will not be able to breathe, and person might eventually die. But if you can, so in that situation, what you might need is an EpiPen, because you might not get the patient to swallow, and then if the patient is in the hospital, they'll give them hydrocortisone. So that's that for allergy reactions. Then heart disease. So majorly, we have heart attacks. A lot of people have. Look at that man. See how he's holding. The next slide, ma. The next slide, ma. Yes, look at that man. See how he's holding his chest. So, quite a number of people can experience heart attack. So that means there is a blockage to the flow of the heart tissue. So keep in mind, time is muscle when it comes to heart attack. So you have to move fast. So the person can say, my chest, they're having an ache or a pressure, the chest is squeezing them. Although this can also happen with people with diabetes and hypertension and the rest, or stroke. But then for people having a heart attack, then before you know it, they won't be able to breathe well and all that. So what you can do is, if you have aspirin will help keep the blood clots from growing bigger, and reduce the severity of the heart attack. And that's if there is no bleeding. You don't use aspirin when somebody has a stroke, or because each person has a stroke, you don't know whether it's a bleeding type of stroke. So you don't use aspirin for that kind of person. But person is just holding the chest. Person does not have a stroke or anything, you can use aspirin. And if somebody that is going through heart attack, start preparing yourself. The first step, you start calling for help and start getting ready to start doing CPR compressions, because person might lose consciousness anytime from that moment, and you'll have called for help so that person can be taken to the hospital. So when you see this someone is having a heart attack, you keep the person and yourself calm. You tell the person to sit down or lie down, very important. And then you call emergency, whether I 112, 737, or a nearby hospital or a family doctor, and then you can give the person aspirin tablets, and then be prepared to administer CPR because it's fatal. It can happen anytime, you know. So yeah. So, and don't allow somebody that is having a heart attack to say they want to drive themselves. That is not good at all. That's fatal. So you can drive the person, to the hospital. Then another thing that is common is fainting. People faint for different reasons. If they've not eaten, if they're hypoglycemic, like if they've not eaten, if they don't have enough sugar, they can faint. If they've not drank water well, if they are severely dehydrated, they can faint. If there is reduced blood flow to the brain, they can faint. So once somebody faints, make sure the person is lying down properly, because some people can faint even on a chair. So make sure they are lying down, because that way, blood flow to the brain is improved. So first thing is, when you see somebody fainting, you ensure that the place is safe. Like I said, danger everywhere is safe. Then you help the person lie down, and then you now lift the legs up if it's possible, because they are trying to get as much blood to the brain as possible. Very important. You lift the legs up. So if person was on a chair, you put them down on the floor, and then you lift the legs up, and then you see that for some patients, they try to start to wake up. But if the patient is not waking up, make sure that you have called emergency, or you have tried to take the person to the hospital. So when somebody faints beside you, make sure they are lying down, then you try to raise the leg up, so that the blood can get to their brain. So I told you that this can also be as a result of low blood sugar. So if it's as a result of low blood sugar, especially people that have diabetes that use insulin, sometimes they've crashed their blood sugar so much that they now have low blood sugar. Or people that have not eaten, people that have been fasting for days, that have not eaten well, they can also have low blood sugar. You see them sweating, you see, all of that symptoms, sweating, um, fainting and all that. So what you can do is to sit them down, and then you give them they need glucose, so you can give them a bottle of Coke to quickly drink, or or milk, or fruit juice, something that has glucose, so they can regain consciousness. In some of these first aid kits, they even have this glucose powder or glucose gel, so you can give them that, but don't give that to somebody that cannot sit up, or somebody that is not conscious, because that person will aspirate. So then that's for that. Next slide, ma. Next slide, ma. We can't see the slide again. I want to talk about stroke. What to do? I think she's not online. Okay, I think she's not online. Somebody asked, yes, I can take questions. Maybe while she comes back online, we take questions, or yeah, before she comes back online, let me take some questions so far on what I've done. So when she comes back online, we continue. Okay, so any question? Anybody with any question? If you have any question, you can write it in the chat box so that I can answer it. Okay, so how do we know if a person's faint is due? So you might not be able to know, only if you have a blood sugar beside you. So number one is ask the patient, is the patient diabetic? If the patient is diabetic, it's most likely due to low blood sugar. Have you eaten at all today? If you start hearing last time, like, last time I ate was yesterday afternoon, it's most likely due to blood sugar. So, yes, I saw another thing. In my opinion, a first aider must not give medication, because sure. So yes, there are medications. We have over-the-counter medications. You can give medications like paracetamol, that is for pain relief. You can give antihistamine, that is allowed. It doesn't have to be given by a medical doctor. They are not prescription-based medication. So it's over the counter. That can be given. I've answered the 2 questions on the chat box. Any more questions, you can put it there. So it's British standard. You can actually have pain relief in your and antihistamine in your first aid box. Yes, but for giving vasoprene, you have to be sure, like I said, the person does not have stroke. And most times when you even use aspirin or vasoprene, it's probably a case. It's probably in a case when, hello, can you hear me? Can you see me? Hello, can you hear me? I don't know if anyone can respond. I want to be sure you can hear me.
Yes, we can hear you.
Yes, we
We
can
can
hear
hear
you.
you.
Very well.
Yes, we can hear you. Thank you.
Okay. Yeah, so I said that aspirin, for most people that you say, oh, aspirin or vasoprene, is mostly given in patients, they know they have heart issues. So they already have it. They already tell you that, please give me my vasoprene or my aspirin. Yes, you can use vasoprene for in that case when there's no aspirin. Yes, so then for emergency number, sorry, I don't know if I wrote 737. That must have been a typo. It's actually 767. That is the correct one. 767, please, 767. That must have been an emergency. That must have been a typo. 767, not 737. Please clear me on the back strike on a choking victim. So I said that when a victim is choking, the first thing is tell them to cough. Try to cough. If with the coughing, the patient is still not able to bring out whatever it is they are choking on, you not tell them to lean forward. You now put the heel of your hand at the shoulder blade below there. You hit it one, another one, like 5 times. It should come out. If it doesn't come out, then you now do the abdominal thrust, like in the picture that was displayed. You put your hand in that place and then you do the thrust 5 times. In an ideal situation, whatever it is they are choking on would be removed. We are still waiting. She hasn't joined back. Any more questions? Okay, let me just continue since when she hasn't joined back. So another situation is stroke. How do you know somebody has stroke? You see them. Maybe the person was talking before. I am coming. Person will just suddenly have a slurred speech. You will even be able to make out what the person is trying to say. You see they are drooping, facial droop. Let's say the slides were on. You see what I mean by facial droop. One side, the face will bend to one side. You will see it clearly. The patient, you tell the person will not be able to feel one side of their body. One side will be weak. Tell them to lift the hand up. They won't be able to lift it up very well. They won't be able to walk properly or even maintain balance. Some of them won't even be able to see. Some of them will tell you they're having severe headache. Some people will even lose consciousness totally. So once you start seeing all that, this person is probably having a stroke. Next thing is to call emergency. That's 112. Then you help the person sit down or lie down. Very important. Help the person sit down or lie down. Then if you have AED around, you bring it out in case the person goes into arrest. You'll be ready to do CPR because there's nothing you can really do until the person gets to the hospital. There's nothing you can really do until the person gets to the hospital. So, but you note all the things. What you need to do is note all the things you have seen so that you can let the doctor know when you get to the hospital. So the aim for someone having a stroke is take them to the hospital as fast as possible. Make sure they are sitting down or they are lying down when it happens. And be prepared to do CPR if you can't get to the hospital quick enough and the person has like a cardiac arrest. So that's what you do. I hope we are still able to follow even without the slides. So that's what you do when somebody has a stroke. You call emergency immediately, or the doctor just try the first step is to try to get them to the hospital. You sit them down, you lie them down, and you start looking, okay, what are the things you notice? Is that person could not talk again, move one hand, because you have to tell all this to the medical practitioner or the medical provider when you get there. Yes, and then be ready to do CPR, because that time when person develop a stroke and when you get to the hospital, anything can happen. Person can arrest, and then if you don't do CPR, person will die. So that is for that. So I don't know if she's back now, so she can show the screen so I can show you what I mean by drooping to one side. Ma, please, can you? Okay, Ma, can you share the slide so that I can quickly show the picture of the stroke when one face is drooping to one side before I move to seizure. Okay, maybe there's
Sorry, I just got back in, so I'm trying to go back to the
share
slide.
the slide.
Hmm.
Okay, so before I move to seizures, I wanted you to share the slides, Ma, so I can show what
Don't worry, I might have to go back a minute or two. I think what you've talked
okay,
about.
so I should continue.
Just go on, yes.
Okay, yes. All right, so we've spoken about stroke. Now let's talk about seizures. That is in Yoruba people call it warapa, like when people that have epilepsy, they have seizures. And then you don't have to also have epilepsy to have seizures. A child or anybody with high body temperature that is not controlled can also have seizures. Head injury can cause seizures. Heart disease can cause seizures. When you ingest a toxin, it can cause seizures. Even when your sugar is too low, it can cause seizures. So when there is like an imbalance in something in your brain, then there will be an irregular electric discharge. You see them jerking, they'll be convulsing. Convulsion, that's the same thing as seizure. So they'll be shaking, convulsing. A lot of people say, put your hand in between their mouths. Hey, put spoon. All of that is wrong. I know someone that put their hand in between the mouth of somebody that's having seizures, and the next thing, the person beats off their finger. So you have put yourself in danger. It won't change or stop anything. So please, when somebody is experiencing seizures beside you, the next step is not to put spoon or put your hand in their mouth at all. The first thing is help them clear. So the ground is clear. You should help them to the ground. Let them lie down. Make sure there's nothing that can injure them on the floor. Then you place a small pillow or towel under their head. You call the emergency helpline. Remember, 767, not 737. Then after the seizure is over, you do the following. You feel the person's pulse. Once the person, because you have to wait for the seizure to be over. So you put the patient down on the floor, clear the ground. Don't have to do anything. Putting spoon in the mouth doesn't change anything. You can even harm the patient by doing that. Put the patient on that recovery position. Can you remember the recovery position I showed you earlier? So you put the patient on that recovery position on the floor. And then once the seizure is over, you feel the person's pulse. I already showed you how you can feel the person's pulse, and that's to make sure, okay, to see that the patient is alive, everything is fine, and you make sure why you are putting the person on their side in recovery position is because some people vomit when they're having a seizure. And if you don't do that, the person can also aspirate and choke. So you put them in recovery position, you check for their pulse. So once the person is calmer, you take the person to the hospital immediately so they can ascertain why that happened. So now let's go back. So she's currently showing us the picture of a man with stroke. So this is what I mean by, you see this. This is not you see it's someone that has stroke. The facial drooping, one face would droop to one side. Although it's not in all people that have strokes, but in most people. The next slide, ma'am. So we've spoken about what to do when the patient has stroke. The next slide. For seizure too, we've spoken about it. Next slide, ma'am. That is not that you start putting your hand in their mouth, you start, all those funny putting spoon in their mouth. Now, look at this slide. This is what I mean. So don't try to hold the person down and tie the person. All of that is not good practice at all. What you need to do is clear the ground, that there's nothing that can harm the person on the ground. Put them on the floor, and then put them in recovery position. See that number 4. See how that's how they will be. Till when they regain consciousness. And when they regain consciousness, you feel their pulse to make sure that they are, the circulation, everything is fine, and then take them to the hospital. So some people can even be having seizures and they are not moving. You see their eyes is wide open and you are talking to them, they don't respond to you. That's also a type of seizure. So you also do the same thing for them. So that is for seizures. Then the next thing we'll be talking about is controlling bleeding. Bleeding happens anywhere and your blood is life. It's very important. We only have just 5 liters of blood in our body. So if there is a cut in a big artery, in minutes, some people's 5 liters out and they are dead. So bleeding is very important. Don't play with bleeding at all because you don't know the artery that has been damaged. So the first way to do that is to apply pressure. So you get gauze, you apply pressure. That's the first thing you do when somebody is bleeding. Apply pressure. It's not to pour water, it's not to put spirit. Apply pressure first for some minutes, then to stop. Then you can now start, for smaller wounds, just apply pressure. And after it stops, then you can now start cleaning with either antibiotic salve or, maybe soap and water, depending on what it is, then you bandage it. So that's when it stops. So the first thing is to apply pressure. Very important. Please, let's not forget it. Apply pressure. And for, bleeding like this, you use your gloves. Like I said, you have to protect yourself. And if there are multiple wounds, you're like, where do I start from? You start with the worst injury, the one that looks like it's bleeding more. You start from there, and then you make your way to the lesser injury. So for sometimes the bleeding is just so much that you might need to use a tourniquet. That means a tourniquet, we have the normal one they use in the hospital. Those things that they tie on your hand, especially when you want to take blood sample. That's what a tourniquet is called. And sometimes you can tie, if you don't have the professional tourniquet, if the blood is a lot, you can tie the upper parts of that injury. So that way you can stop the bleeding. And note the time that you tied it, so that you don't stop blood flow and then the hand becomes amputated. It's not something that's supposed to be tied for too long. So that is how you control bleeding. Then the next thing is teeth injuries. Some people have teeth injuries. Your broken teeth, chipped teeth. Sometimes the teeth can even be completely knocked out. So when you are dealing with somebody's teeth, make sure you are using gloves. And then the teeth can be reimplanted and transported to the dentist. So there are some teeth that if the root is not damaged, they can actually fix it back. So how do you do it that you don't damage it before you get to the dentist? You wash the teeth with clean water. You make sure that don't scrub it too and don't touch the root of the teeth. You put it inside, you can transport it in milk to the dentist or in salt and water solution. Or you put it, for someone that is cooperating, you put the teeth under their tongue till you get to the dentist, and then the dentist will take it up from there. So that is it. Then we have nose bleeding. Nose bleeding can also occur anywhere, anytime. So when somebody is bleeding from the nose, what do you do? Please look at the image of nose bleeding. Next slide, please. Next slide, I want to show them something under nose bleeding.
What did you say? Sorry.
Nose bleeding, the next slide.
Okay, next slide. Sorry.
So for nose bleeding,
Okay,
look at this. I marked it X, like this is wrong. When somebody is bleeding from the nose, you don't tell them to put their nose up. No. They are going to put it down. You compress it down. That's the best way to stop bleeding. So ensure the scene is safe. Put on your protective equipment. So that means if there's a lot of blood, you might have to wear gloves. That's what we mean by that. Then you now use your hand to put pressure on the bony portion of the nose, and you press it for a minimum of 5 to 10 minutes. So if after that 10 minutes, the bleeding still continues, you press it again for 10 minutes. So you make sure that the patient is seated upright and the body is leaned forward a bit. And then you are pressing lean forward a bit like it's shown here. So that will keep the blood from running down the throat, and which can cause vomiting. So when the person is leaning forward, you keep it from running down the throat. You understand? So this is how you should do it. So and don't lay the patient flat don't put the patient flat, like lying down on the ground. Don't do that. And don't make sure that the head is not between their legs. So okay, as much as they are saying lean forward, just lean forward small, not to the extent that the head is between their legs. No, don't do that. So once the bleeding has stopped, don't tell the patient they must not blow their nose or pick their nose till they get to the clinic. So that's how to handle nose bleeding. Then the next thing is eye problem. Anything can happen. Somebody can blow your eyes, a foreign object can enter your eyes. What you should do when you have eye problems or something can enter is to use water. So that blow my eyes for me, no, it's not correct practice. You put your eyes under running water and you wash it. So that's the best you can do for your eyes. And if it doesn't get better, you report to the hospital. And then if maybe something got into your eyes, maybe a sharp object. So instead of covering just one eye till you get to the hospital, cover both, because by the time you cover one eye, it will affect the second eye. So if there's something, so you cover both eyes. So please, whenever anything enters, you wash the eye instead of saying blow my eyes, because that way the person can get germs and into your eyes by blowing the eyes, because their saliva and all that is going into your eyes. Then another thing that can happen is bone and joint injuries from falls. As you get older, we can lose balance, easily fall. And when we fall, we can have you see your ankle swelling or whatever. If it's your hand, you see like a swelling and that place is paining you. So what do you do when you see that? The first thing you do is to rest. That leg, you raise it up and you put ice. You put ice on the leg for up to like 20 minutes. That's what you do when you have a sprain. Not that you start getting, I hear some funny things that some people put hot water. No, you don't need all that. Ice block, put it on your leg when a fall happens. Look at something like this. In your first aid kit, you see a bandage, you just wrap it around like that. Make sure it's not too tight, and if there is no fracture there, in 1 to 2 days, the leg should get better. So how do you even know this? You can't know if there's fracture or not without doing an x-ray. So if in 2 days after doing all this, the leg doesn't get better, please report to your hospital immediately so that you can be given an x-ray form to go and do x-ray. So the x-ray will now determine if there's a fracture and if they need to refer you to physiotherapist or orthopedic surgeon. Yes, so that is that for the bone and joint. So like I said, if somebody had sprain or broken bones, we ensure that the the scene is safe. Sometimes even in an accident, some people's leg will break in a way that even the bones is shooting out of the skin. Don't try to push it back in. Don't try it. Just take the patient like that to the hospital. Don't try to push it back in. If the bone is broken inside, it's not like it's shooting out, you can use a splint. What I mean by splint is you try to balance the place. Like you can get a hard cardboard or a wood, put it on both sides and you tie it. Just balance to give the leg some balance so you get to the venue. Yeah, so those are the things I do. But for normal basic sprain, there is not an open wound, you use ice pack for up to 20 minutes and you raise it up. Then the next thing is burns. So in the kitchen, when you are frying fish, you are frying meat, anything can happen. You can have burns from hot oil or from fire or even hot tea. The first thing you do when you have minimal burns like that is to run it under water. Not go and get ice block or ice water. It's water, normal water from the tap for at least 20 minutes. So I know some people might not have the patience, but please just put your hand under water, when you are, that's the first thing. Is not to go and put pap or egg or toothpaste on it. Then after that, in your first aid kit, you should have like an antibiotic or a burn ointment. Like there's something called Wilson ointment. It should be in all your first aid kits. You just rub it on it, and in a normal uncomplicated burn, it will dry in a few days. And then if there's a blister, don't burst it. Only if it is burst professionally in the hospital, don't burst it yourself. It would resolve by itself. So, and please do not apply ice to a burn injury. It will just make it worse. So you go to the hospital immediately if the burn is large. There's nothing you can do about it. Or if it's on the face, even if it's small, but it's on the face, it's on the hand. When you say hand, we are talking about the part like your elbow area is on your genitals, maybe please, on your knee, all those places would require immediate attention by the medical professional. Or let's say it's inhalational burns, like there's a lot of smoke and there's difficulty in breathing. So please try to take the person immediately to the hospital. And in a fire situation, what you do is tell the person to stop, drop, and roll. if it's a small fire. So they stop where they don't know, they start running with the fire to just make it worse. They stop, they drop down, and they roll on the floor. And then if it's something that you can also use like a big blanket to extinguish it, and remove the blanket after the fire is out. So to see the fire go out, if it's something that is small. Yeah. And then if there's possibility of carbon monoxide or exposure, like, I'm sure when we're at some point in the news, you hear, they switch on the generator overnight, the smoke from the generator kill them before morning. So that kind of exposure, you take them to the hospital immediately. So when there is burns, if there's cloth on it, don't start trying to remove it, because that way you can even cause further injury. So those are the major points when it comes to first aid that you should know. So you stay calm and act quickly. First aid and CPR are life-saving skills. Anyone can do. Every second counts. Every second counts. That thing that you do can either make or mar. Even burns, whatever you do in that minute can make the recovery of that patient better. If you do something bad, it can make it worse. So those are the points I have. So thank you, and I'm ready for the question and answer.
Thank you so very much, Dr. Adegoke. A very interesting and explanatory presentation. Much appreciated. Thank you. So right now, we are in our questions and answer session. Yeah, the chat box is filled with so many questions, and I won't go over everything it is that she said because it's been more than explanatory. So I'll just go straight to the questions in the chat box. And also, if you have any question, you can please raise your hand and you'll be called upon. So I'll take some of the questions here. Doctor, please, for
Yes, ma'am.
average, how long can the tourniquet be applied?
Hello, can you hear me?
What?
Hello, can you hear me? Can you hear me?
Yes, we can hear you. Yes, I can hear you.
Because it's kind of breaking
Did
over
you get the
here.
question?
No, please repeat.
Okay, someone is asking, for how long can the tourniquet be applied? I'm not sure what he means by tourniquet, so maybe you have an idea. Hello, doctor, are you still there? Uh-oh. Hello, doctor. Hmm. Can you unmute yourself? I don't know why you're muted. Hello, doctor, are you
Sorry,
there?
I think I
can't
got
see
logged
you.
out.
Oh, okay.
Yes, so you were telling me about the questions.
Okay, let me just go to the next. Is the foamy saliva from someone that has seizures, is it contagious, as many believe? Saliva from someone having seizures.
Oh, sorry, I
is
was
it
muted. Sorry. The only thing about saliva from someone that has seizures is not directly contagious, as the superstition says. It's just that any bodily fluid from somebody can be contagious because you don't know what they have. So at that point, it's just like you're dealing with somebody's spit or somebody's blood. Do you understand? So they are probably saying that because so that you keep away from it. You understand? So imagine a person has, for example, something contagious like HIV now, and if it's blood, you say it's contagious. So same as that foaming fluid can also be that contagious. So that is probably from that angle. But what the superstition is saying is not, it doesn't mean person will have epilepsy till they touch it. No, that's not what it means. It just means that you don't know what the person has in terms of disease and illnesses that are contagious that you can get infected with. So I don't know if I was able to answer that
Okay.
question.
Yeah.
Yes,
Yes.
you were asking something
Another
about
one.
before deforming fluid,
Unfortunately,
like.
the question has disappeared. I think I'll get it back. So let me just go on with
Okay.
the other ones.
All right.
Someone is saying in his or her, I'm not sure if it's a lady or a gentleman. In my opinion, a first aider must not give medication because he or she is not a medical doctor. Also, the first aid box should not have paracetamol as one of the contents. Well,
Okay,
I'm not sure about that.
well, it depends. So generally over here, you're allowed to have anti-paracetamol and also antihistamine in your first aid box. But then it should be used by an adult. Like you shouldn't expose it to children. That's just the caveat. In every first aid box, there are rules, there are ways to use these things. So, but it's very important you have paracetamol in the first aid box because you could be running a fever, and that paracetamol is what will bring it down and not allow you to develop a seizure from high body temperature. So, yes, you should have paracetamol and antihistamine in your first aid box.
Okay, so we should have paracetamol in the first aid box, right?
Yes, we should.
Okay. Okay.
It's just
All
that
right.
when it comes to it's an over-the-counter drug. It's not a prescribed drug. And when it comes to medications, you should just make sure that it's adult supervised.
Okay. Another one. How do we know if a person faints due to low blood pressure?
Low to low what? Blood pressure or
Blood
blood sugar?
pressure. Yeah.
Hello?
Yeah?
Did you say blood pressure or blood sugar?
No, low blood pressure. How do you know if a person faints as a result of low
And you might have
blood
to
pressure?
you might have to check the blood pressure of the patient afterwards. And then we have something called orthostatic hypertension. Like maybe when the patient wants to stand up, that kind of thing, but it's rare. So most times you don't see people fainting due to low blood pressure. The only way you can know is if you check the blood pressure. I thought you meant blood sugar, which I wanted to explain because that is the one that is more common when somebody faints due to blood sugar. You see them sweating
Okay, you can
profusely.
quickly share that with us.
Yes, you
The
see
low
them
blood
sweating.
pressure.
Yes, you see them sweating profusely, and then most times you ask, "Are you diabetic?" Person could be diabetic, so it might be, because they are diabetic. And when they are diabetic, they take drugs and all those things, and sometimes it can overcrash the blood pressure, leading to low blood pressure. Or if the person has not eaten in a while, that could also be a cause. Hello?
Yeah.
Yes, so I've been able to answer that. So
Okay. So next one, can vasoprene, I think that's the pronunciation, can vasoprene be given in case of aspirin?
yes, but it all depends. You have to make sure that the person you are giving that to is not bleeding or does not have a bleeding disorder. Yeah, it can be used temporarily in place of aspirin.
Okay. Is the emergency, I think, is the emergency number 767 or 737? I
It's
think
767. It was the typo.
767
767. 737 is for GTB.
is for
767 is
GT.
the emergency. Is
Exactly.
the emergency. Yes, that's the typo.
Okay. Someone wants you to I think quickly give a recap of backstrike on choking victim.
Oh, I said, okay, when the person is choking, the first thing you do is tell them to cough. If they cough, and that thing is not really, if it's not really deep down, normally it should come out. And if it doesn't come out, you tell them to lean forward a bit. And then you now put your shoulder, your hand, your wrist, that's the heel of your wrist there. You put it on the shoulder blade under there, you push it, you do it 5 times. Ideally the thing should come out. And then if it doesn't come out, then you now do the abdominal thrust, like I showed you in that picture. Yes.
Okay. All right. Next one. How would it be possible to press the chest between 100 to 120 times within a minute?
It's very possible. You have to be skilled. You have to be skilled and you have to be fast. It's very possible. That's the standard way of doing CPR. So then you might need a hands-on training for that, but you have to be skilled and
Yeah, I
fast.
think
So you be
it's better
timing yourself.
it's better we have a
Yes.
practical session for
Yes.
this.
So after this, if you want to try, you can get your pillow and and then put your timer on, and you see that you should be able to do 100 compressions in 1 minute. It's very possible. It's because you have not practiced it. That's why you think it's not possible.
Okay.
All right.
Okay, I've seen the question. On average, how long can the tourniquet be applied? Tourniquet, I don't know.
Okay, so number one, applying a tourniquet depends on the
Okay,
severity of
tourniquet.
the
Okay.
yes. Applying a tourniquet depends on the severity of the bleeding. So you can't apply a tourniquet if the bleeding is not a lot. Like, but if bleeding is a lot and you know that maybe it's one artery from up there, then you apply the tourniquet. You can apply it for up to 2 hours and you're sure that there's no problem. But within that 2 hours, every 30 seconds, you release and apply back, release and apply back. Do we understand? So yes, so more than 2 hours, you can risk losing that limb. So make sure that person is already in the hospital with you, and then tell them in the hospital that you apply this tourniquet. It's been on for 1 hour, 30 minutes, for 2 hours, whatever time it is. So just make sure that within 2 hours. So that's enough time to get somebody to the hospital. Yeah. And then within that 2 hours, every 30 minutes, make sure you release and reapply back so that you don't lose that limb or that particular part of the body you're applying tourniquet on. I hope I've been able to answer that question.
Yes, I believe so.
Any other
Okay,
question?
those are the only questions we have in the chat box, and there are no hands up. So I think those are the only questions we have. All right, thank you so very much, Dr. Adegoke. We really appreciate your presence this morning. But please, before you go, can someone please volunteer to appreciate our facilitator for today? It's 12 o'clock now.
Hello, good afternoon.
Good afternoon, ma. Thank
Hello,
you,
good
ma.
afternoon.
Good afternoon, ma.
Yeah, thank you very much. Usually I don't do this, but I just want to
Thank
do
you.
this today because I've been on from the very beginning and it was quite enlightening. Dr. Adegoke, you have done very well. I can give you 100% really. Yeah, you deserve it. Thank you so much. I believe we have all learned a lot, some things, especially the one that touched me, the area of seizure. I want to believe majority of us are guilty of not applying the right first aid box. And this must have caused a lot of damages or even deaths. So we have learned a lot today. And I am pleading PSO, please help us to send the link as we usually do so that we can spread the good news. So once again, Dr. Adegoke, we love you dearly. We thank you so much for your patience. And I pray that the Almighty Allah will be with you and guide you in all your doings. Thank you very much. PSO, we are grateful for this fortnightly workshop. The head of service and the permanent secretary, we are grateful.
Yes,
Mrs.
ma'am.
Drodola and our team, thank you very much. God bless you. Thank you.
Amen. You too, ma'am. Thank you so very much, ma'am. Thank you. So yes, we will send the slides. We'll send the slides on the Metaris platform, and you can also go back to YouTube because it's on YouTube right now. It's live right now. But if you want to just, go back to what we talked about, just go to YouTube and you would see this particular session and the previous ones we've had. All right, so thank you, everyone. We appreciate your presence. We can now please all unmute ourselves as we usually do so that we can say hello to one another. Good morning.
Great. Wow.
Good morning, good morning, good morning, everyone.
Good morning, ma'am.
Good afternoon.
Thank you very much. God bless you.
Yeah, welcome, sir. Good morning, sir.
Yeah, thank you. Good afternoon. Thank you very much.
Good afternoon, all. Good afternoon.
Oh, good afternoon. Sorry. Good afternoon. Wow.
It's afternoon
We really
already.
spent
Good
a long
afternoon.
time today. Good afternoon.
Bye. Mm.
The matron, ma. Good afternoon, ma.
Good afternoon. Good
Thank
afternoon,
you very
everyone.
much.
Thank you for joining. Thank you,
Yeah,
thank you, thank you.
thank you, ma.
Hello, madam. Thank you.
Okay.
God bless you. Well done.
Amen. I you too, ma.
Thank you. Yeah.
Yes, ma. Thank you.
Yes.
Okay, so we'll have another session in 2 weeks' time by God's grace. And we look forward to seeing or hearing from everyone. And we'll definitely bring you another interesting and enlightening, excuse me, an educative topic. So thank you once again for joining, and we'll sign out now.